All right, so this is the stuff you're gonna pull out separate from your lumbar puncture tray. You're gonna pull out a 10 ml syringe, that's if they use it to aspirate, which most of them do. You're gonna pull out your spinal needle, your control syringe for lidocaine. You're gonna pull out your green tubing, because that's what they connect to the spinal needle to aspirate. And then this is DuraPrep. So you only use DuraPrep with spinal stuff. There's also some in the tray, but this, it can be used, you can either drop it sterilely or we can use it to prep ourselves. Most of the doctors, I think, like this one. And then this is our drape that you put over the spot after you clean it. And then these two you won't be dropping on the tray, but you'll want to put them on after you get the patient on the table. All right, so we've dropped our drape, all the other stuff that we pulled out. The first thing I like to do is just get everything out of the way that I don't need. So 9 times out of 10 we don't use this, so you can just drop that. These are the DuraPrep like swabs they use instead of the big one, so we can keep these on just in case they want to use that. This is what we'll use to cover the tray after. And then we'll just get started. So I always pull this is for sharps. Just unpeel it and stick it on there so you can stick the sharps in that. And then the first thing they do after they clean is they're gonna do numbing. So you use your control syringe and you're gonna put the filtered needle on, which is this purple one that's on the 5 ml. So you take that off, you're gonna put it on here, and then you're gonna get a 4x4, and this is the lidocaine. So you just wanna make sure it's vacuum sealed. So you just wanna make sure that there's no medication in the cap. So they said you can just kind of like shake it around till all of that's off. Out of there, come on. Doesn't normally take this long. Okay, all right. So you take the 4x4 and you're gonna pop it off right at this, like where it kind of comes in. You do have to use a little bit, but it's not gonna hurt you at all. So you pop it off and you're gonna stick this back in that hole. And then this is technically a sharp, so make sure when you drop that off, you know to put that in sharps. So then you're gonna take your filtered needle. So this just ensures that there's no glass being sucked up into the vial. Then you take it and it's vacuum sealed. So you can turn it all the way upside down and there's gonna be no medication that comes out. And then this is also where it's important to always keep your needle in the liquid. You're gonna drop all of this, maybe. There we go. So you're gonna pull up all 10 mLs of this. Just like that. Get all your air out so it's not 10.
Can you take a phone call to
Imaging Diagnostic.
5 mLs.
Can you take a phone call to
Imaging Diagnostic.
from Mama Workroom?
Perfect. So it's actually just 5 mLs instead of 10. So you do this and you never recap a needle. You're gonna use the scoop method, pop that on, and then we are done with the filtered needle. So you take off the filtered needle and you're gonna put on like this blue-green tip, and that's what you use to numb the patient. Make sure that's on nice and tight, and then you're gonna use the lidocaine sticker, and you're gonna label this with lidocaine, and put it on long ways and on the clear side. You don't wanna put it where the numbers are. So we're gonna stick that on and just set it right next to the prep, because first they clean, then numb. So then after they numb, they're gonna stick them with the spinal needle. And this is a different gauge spinal needle, so you can leave it on there or take it off. This is the one that we always drop, it's the black one. So after they numb, then they poke, and then they're gonna aspirate. So this is the 10 ml that we dropped, and this is the tubing they use. There's a couple of them, I think Kelly likes this short tubing. IR said that we can just keep it on. So just kind of move that out of the way in case they want it, but most of the providers use this tubing here. You're gonna take off both of these clear ends, they just pop off. Maybe, there we go. Pop off like that. And then the short side is the one that connects to the syringe. And you're just gonna keep that tubing next to the spinal needle, because after they poke, then they'll aspirate. So from there, just kind of like clean up. Well, first we're gonna open all of these vials. So this is what they use to collect the CSF. So you wanna do it, you wanna bend it back so that it stays open, because they're gonna just drop it in there from the tubing. And make sure that it's in order from like 1 to 4, because it matters for when they test. So make sure it's vial 1 and vial 2. And then 3 and 4. And then another part of the tray are these measuring. So this is what they use to do like opening pressure and closing pressure if they request it. So these will just stay here, and then this is the connector they use if they need to extend it. So these will all stay here, the extra tubing. So now we can just kind of get rid of the things that we don't need. We don't need the marker anymore. We don't need this blue needle, so we can drop that, make sure it goes into sharps. We don't need the filter needle, the caps, or the 5 ml because we have our 10 ml. We don't need this labeling anymore. And then, oh yes, we take the Band-Aid out of the cover, because then after they're done, then they'll just put a Band-Aid on, so that we stick that kind of in the order we're doing it. And then you'll take this off, but you want to save it because this is what you scan to charge for medications. It's also a sharp, so just be careful. And then we'll put this kind of on top, because after they clean, then they'll put that on. And then I just use this white one that it comes with to cover, so that it stays sterile for when we bring the patient in.